State health officials continue to encourage Hoosiers to get vaccinated, but they don't want to enact new statewide restrictions like we've had in the past. But some counties are choosing to enact new health orders. As Ethan Burks reports, the Monroe County Board of Commissioners officially reinstated a local mask mandate this week.
Surging COVID-19 cases, stagnant vaccination rates, and the spread of the easily transmissible Delta variant all contributed to the county's decision to again mandate masks.
When we removed the health regulations earlier this summer, vaccinations were rising, cases were dropping, and we fully expected that to continue. Unfortunately, it has not.
Over the last few weeks, the county has gone from a blue advisory on the state's COVID-19 dashboard to yellow to now on the border of becoming orange. This is what the CDC defines as a substantial risk for community spread.
The virus is spreading among all ages, and we have a large number of the community still susceptible because they are unvaccinated.
57% of the county's eligible population is fully vaccinated against the virus. Caudill says that number is not high enough, especially given the prominence of the new Delta variant. The Indiana Department of Health reports nearly 90% of all COVID test samples within the last month contain the Delta variant. The CDC considers this type of coronavirus to be as contagious as the chickenpox. Despite this scientific discovery, state officials still contend they will not reimpose any COVID-19 restrictions.
We are really trying to allow and have heard clearly from our local elected officials and from our schools that they want to make these decisions locally, that it's important to them to be able to make the decisions. And so, we are giving strong recommendations, strong guidance, and giving the science behind those strong recommendations and guidance.
Dr. Bach says the science shows everyone should get vaccinated as quickly as possible, and that's something local health experts have been emphasizing for months.
Delta is more easily transmitted, but doesn't really provide any greater danger to those who are vaccinated. It is not as if it's increasing hospitalizations or making things really bad for those who are vaccinated.
In extremely rare instances, fully vaccinated individuals have been hospitalized with breakthrough cases, but the data indicates it very unusual.
Across the state of Indiana to date, only 132 fully vaccinated people have been hospitalized, which is 0.005% of fully vaccinated people.
That's why Indiana University is requiring all students, staff, and faculty to be fully vaccinated before the fall semester begins. And the university announced this week it's also following the county's lead in requiring masks indoors. It's perfectly fine to take your mask off when you're outdoors, but inside any IU campus buildings, you must put on a mask again, even if you're fully vaccinated. Dr. Carroll says he expects IU will still have in-person classes, full dormitory capacity, and live sporting events with fans in the stands this fall. He maintains that the vaccine requirement actually makes the Bloomington campus one of the safest places in the whole state.
Your chance of catching COVID from an IU constituent is lower than almost anywhere else you'll go. Supermarket, restaurant, bar, anything else that you might do, because most of us are vaccinated.
The county has set a rough estimate for the mandate to end sometime around the end of September. That's when health officials will meet again to examine the local data.
I expect it will take several weeks, and everyone following recommendations and following regulations in order to get out of this and to do it quickly.
For Indiana News Desk, I'm Ethan Burks.
Both the county and IU will not place any additional restrictions such as gathering size limits or required 6 feet of distance between individuals indoors.